Hello and welcome. Today, we're diving into a critical and often misunderstood heart condition, cardiac arrest. While often used interchangeably with heart attack, cardiac arrest is a distinct and often fatal event that demands immediate attention. Understanding what it is, why it happens, and how to respond can save lives. This video aims to equip you with the knowledge you need. So, what causes this sudden and terrifying event? In most cases, cardiac arrest stems from an electrical malfunction in the heart. Think of your heart as having its own internal wiring system. When this system goes haywire, usually due to underlying heart conditions, it can lead to irregular heartbeats, known as arrhythmias. These arrhythmias, such as ventricular fibrillation or ventricular tachycardia, disrupt the heart's ability to pump blood effectively. Other causes include coronary artery disease, heart failure, cardiomyopathy, and congenital heart defects. Trauma, severe blood loss, and certain drug overdoses can also trigger cardiac arrest, especially in people with pre-existing heart conditions. To understand cardiac arrest, we need to delve in the pathophysiology, or how the disease develops. As mentioned, it all boils down to the heart's electrical system. When an arrhythmia occurs, the heart's chambers may quiver erratically instead of contracting in a coordinated manner. This means the heart isn't pumping blood effectively, or at all. Without blood flow, vital organs like the brain and kidneys are deprived of oxygen. Brain damage can occur within minutes, and without immediate intervention, death is almost certain. The lack of blood flow is what distinguishes cardiac arrest from other heart problems. Cardiac arrest is a significant public health concern. It affects hundreds of thousands of people each year. Statistics vary depending on the region, but it's generally understood that the survival rate outside of a hospital setting is unfortunately quite low. Men are slightly more likely to experience cardiac arrest than women, and the risk increases with age. People with pre-existing heart conditions, a family history of heart disease, high blood pressure, high cholesterol, diabetes, and those who smoke or lead sedentary lifestyles are all at higher risk. Furthermore, communities with limited access to emergency medical services also experience higher rates of mortality from cardiac arrest. Recognizing the signs and symptoms of cardiac arrest is crucial, although the onset can be incredibly sudden. The most prominent sign is the sudden loss of consciousness. The person will collapse and be unresponsive. They will not be breathing normally or may only be gasping. There will be no detectable pulse. It's important to distinguish this from fainting or seizures. While fainting can cause a brief loss of consciousness, breathing usually returns quickly and a pulse is present. A seizure may involve convulsions, but the person is usually still breathing. If you suspect cardiac arrest, immediately call emergency services and begin CPR. Diagnosing cardiac arrest is usually done after the event has occurred and emergency medical personnel have arrived. An electrocardiogram, or ECG, will be used to analyze the heart's electrical activity and identify the specific arrhythmia that caused the arrest. Blood tests can also be performed to look for markers of heart damage or to rule out other underlying conditions. If the person survives, further tests, such as an echocardiogram or cardiac catheterization, may be conducted to determine the cause of the cardiac arrest and assess the overall health of the heart. While cardiac arrest itself isn't classified into distinct types, in the same way as heart failure, the underlying arrhythmias that cause it are ventricular fibrillation (VFF) and ventricular tachycardia (VT) are the most common culprits. VF is a chaotic, disorganized electrical activity that prevents the heart from pumping. VT is a rapid, abnormal heartbeat that can quickly degenerate into VF. Other, less common arrhythmias can also lead to cardiac arrest, but VF and VT are the primary targets for immediate intervention. Pulseless electrical activity, as it PA and asystole, are also presentations of cardiac arrest. PA means there's electrical activity in the heart that isn't causing it to pump, and asystole is the complete absence of electrical activity. The immediate treatment for cardiac arrest is cardiopulmonary resuscitation, or CPR, and defibrillation. CPR involves chest compressions and rescue breaths to keep blood circulating and oxygen flowing to the brain. Defibrillation delivers an electrical shock to the heart to try to reset its electrical activity and restore a normal heartbeat. Early CPR and defibrillation are critical for survival. After resuscitation, treatment focuses on identifying and addressing the underlying cause of the cardiac arrest. This may involve medications to control arrhythmias, procedures to open blocked arteries, or implantable devices like pacemakers or implantable cardioverters, defibrillators, or ICDs. An ICD is a device that can automatically detect and correct life-threatening arrhythmias. Preventing cardiac arrest involves managing risk factors and addressing underlying heart conditions. This includes maintaining a healthy lifestyle by eating a balanced diet, exercising regularly, and avoiding smoking. Regular check-ups with a doctor are important to monitor blood pressure, cholesterol levels, and blood sugar. People with known heart conditions may need to take medications to control their symptoms and prevent arrhythmias. In some cases, preventative procedures, such as angioplasty or bypass surgery, may be necessary to improve blood flow to the heart. Awareness of family history and genetic predisposition to heart conditions is also crucial for proactive prevention. The prognosis after cardiac arrest depends on several factors, including how quickly CPR and defibrillation were administered, the underlying cause of the arrest, and the overall health of the individual. Survival rates are highest when CPR and defibrillation are initiated within minutes of the arrest. However, even with prompt treatment, many survivors experience long-term complications, such as brain damage or heart failure. Recent research focuses on improving survival rates and minimizing long-term complications. This includes developing new CPR techniques, improving defibrillation technology, and exploring new medications to protect the brain from damage during and after cardiac arrest. Researchers are also working on better ways to identify and treat individuals at high risk of cardiac arrest before it occurs. For example, studies are investigating the use of artificial intelligence to predict cardiac arrest based on ECG patterns and other patient data. While cardiac arrest remains a serious medical emergency, ongoing research offers hope for improved outcomes in the future.